Assalamualaikum. In this slide, we will be discussing about motor neuron disease. But first and foremost, I will introduce who is Mukhtar Dahari. Datuk Muhammad Mukhtar bin Dahari was a Malaysian professional footballer. He played for FA selama in his football career. He is considered as a legendary footballer in Malaysian history. His nickname was Super Moh due to his playing skill and strength. Mukhtar is the all-time top scorer for the Malaysian national team. He was born in Selangor on November 13, 1953 and died on July 11, 1991. The cause of his death was ALS, which is one of the motor neuron diseases. Motor neuron disease (MND) is neurodegenerative disorder characterized by the gradual deterioration of motor neurons. These neurons play a crucial role in transmitting signals from the brain and to the muscle, facilitating voluntary movement. Especially, this disease primarily affects these motor neurons, becoming the focal point of degeneration and resulting in a progressive loss of muscle function. Common characteristics include stiffness and muscle weakness, eventually leading to paralysis. Amyotrophic lateral sclerosis (ALS) is one of the specific types within the spectrum of MND. Moreover, motor neurons control muscle activity like gripping, walking, speaking, and breathing.
You must be wondering, when was the motor neuron disease, or MMD, is first discovered? Well, a French physician named Jean-Martin Charcot is the first identified the motor neuron disease, or MMD, in 1874. Despite his intensive research, the cause is remained unknown. He began to use the term of amyotrophic lateral sclerosis in 1874. The disease is also known as Lou Gehrig disease in the United States, Charcot disease in French, and motor neuron disease (MMD) in UK. He and his colleagues studied that lesions within the lateral column in the spinal cord resulting in chronic progressive paralysis and contracture, or no atrophy of muscle, while the lesions of the anterior horn of the spinal cord resulting in paralysis without the contracture, or with atrophy of muscle. This finding supported his hypothesis at the time that motor component of the spinal cord consists of two-part system, and that the location of lesion result in a varying clinical presentation. And this is when the motor neuron disease was first discovered. Onto the case study, Mukhtar Dahari was first diagnosed with motor neuron disease, or MD, a type of neuron degenerative disease which causes the gradual loss of motor neurons that coordinate the muscle movement. In 1991, after battling the disease for over 3 years, Dahari lost the battle. He was pronounced dead by July 11 in 1991 at Subang Jaya Medical Center in Malaysia. The cause of his death was kept under the wrap around that time because around that time, the community was not widely exposed to the motor neuron disease, so the press reported muscular dystrophy as the cause of his death. Muscular dystrophy is a group of disease that cause progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal gene or mutation interferes the production of protein needed to form healthy muscle. They assumed this was his cause of death because he was actively playing football at that time. It was only the release of documentary The Untold Truth of Super Moh. 90 years after his death, the world came to know about the real reason of his passing.
Now, we will go to how to diagnose MND. First, doctors will diagnose MND by blood test and urine test. This can help rule out other conditions and detect any rise in creatine kinase, a substance that muscles produce when they break down. This is to look for causes of inflammation in the spinal cord or to look for supportive evidence of damage to the motor nerve. Next, magnetic resonance scanning, MRI. The medical team may decide to perform an MRI scan based upon the patient history and examination. MRI scans are performed in the radiology department and the images are reviewed by a specialist doctor called a radiologist who reports the scan. The MRI scan cannot diagnose motor neuron disease but can look for evidence of other causes of a patient's symptoms such as damage to the spinal cord, the neck, which is upper motor neuron, and the nerve that leaves the neck to supply the muscles, lower motor neuron, caused by wear and tear changes. This is a painless, non-invasive test. Nerve conduction studies, NCS, and electromyography (EMG. It is very likely that the medical team will request this test for all patients being investigated for motor neuron disease. A specialist doctor called a neurophysiologist performs the nerve conduction and EMG test. They will decide which nerve and muscle to test on a case-by-case basis and then analyze the result to establish whether or not the findings support a diagnosis of MND or a suggestive of another condition. Sometimes, a patient may have to undergo nerve conduction studies and EMG on more than one occasion so that any changes over time can be identified. Nerve conduction studies test the peripheral nerve, which are made up of lower motor neuron and sensory nerve. Electromyography or EMG involves inserting small needles, like acupuncture needles, into muscle in different parts of the body. This is not dangerous and very rarely painful. Analysis of the electrical activity and activation of the muscles can identify changes consistent with MND or those that might suggest a different cause. Lumbar puncture or spinal tap that involves sampling the cerebrospinal fluid that surrounds the brain and spinal cord, acting as a shock absorber. The procedure is usually performed by asking a patient to lie on their left side. The lower back is clean and the area is made numb by using a local anesthetic. A needle is then inserted into a space between the bones of the lower spine to obtain the cerebrospinal fluid. Last, a muscle biopsy is a procedure used to diagnose disease involving muscle tissue that will remove tissue and cells from a specific muscle and view them microscopically. The muscle selected depends on the location of symptoms, which may include pain or weakness. The muscle often selected for sampling are the bicep, deltoid, or quadriceps.
So you guys must be wondering what is the symptom of MMD, right? There are 3 stages of symptom of MMD disease. The first one is early stage, which is weakness in leg or ankle, cramp and muscle twitching. Secondly, advanced stage, thinning of muscles, speech, difficulty in swallowing and weak grip. And lastly, end stage, which is body paralysis and respiratory problems.
To get into further knowledge about the motor neuron disease, we need to know what are the factors that might increase the chance of having it.
These are the factors that might increase the chance of having motor neuron disease. The first one is genetic factors, the second one is environment, and lastly, the lifestyle.
Even though the exact factors that will increase the chance of having MND is still unclear, the study has shown that 10% of the patient is usually from genetic, and the study has also found that there are some similarities of the patient, which is from the lifestyle and the environment. Alright, let's get into the first factor, which is genetic factor. Genetic factor, which is also known as familial or hereditary MND, has become the only factor that researchers has become sure of as the cause of having MND. There are 1 in 10 people with MND have a family history of the disease, which makes the 10% of the MND patient is from the genetic cause. So the inherited MND is caused by mistake in the genetic code that hold the instruction for making each protein in our body. The shown above are the sum of the genetics that are known to cause a family history of MND. So even though the genetical MND patient usually developing the disease, there are some cases that the direct bloodline of the MND patient will only be a carrier of the MND and will not be developing the disease. And these genetic factors can be identified through genetic testing at the medical center. Moving on is the lifestyle and environmental factors, which are still in the study of the factors that might increase the chance of having motor neuron disease. So, the first one is mechanical or electrical trauma. Secondly, military service. Next, high level of exercise and frequent strenuous exercise. Then, the exposure of the agricultural chemicals. And lastly, the exposure to the variety of heavy metals. These are the factors that are still in research as one of the factors that might increase the chance of someone having motor neuron disease, as the researcher has found the similarities of the lifestyle and environment of the patient. Next, after we determining the factors that might increase the chance of having motor neuron disease, we will link it to the death of the famous Malaysian football player, which is Mokhtar Dahari, which has been diagnosed with the motor neuron disease. As I mentioned earlier, frequent strenuous exercise might be one of the reasons of having motor neuron disease. And as a football player, Mokhtar Dahari has been training and have frequent strenuous exercise to maintain his condition and his performance as a top Malaysian football player. This statement could be supported by the previous research that it has been estimated 6 times of the increased risk of having MND is in the professional football player compared to general population, as they always need to exercise with frequent strenuous exercise to keep the condition of an athlete. And the research also states that the patient of MND have early age of disease onset if they have the lifestyle, which includes a high level of strenuous physical activity, which could apply to the late Mokhtar Dahari, as he started off his career as a football player when he was only 19 years old, when he first played for the national team in an international game.
Next, we are going to talk about how to avoid and reduce the risk of motor neuron disease. Since motor neuron disease (MND) is a rare condition that progressively damages part of the nervous system, which lead to muscle weakness. Therefore, there is no specific way to prevent someone from developing MND and to cure this disease. The researchers still need more work to discover the specific way to cure this disease. However, there are different treatments available that can help to reduce the impact if someone have MND. Riluzole is the only drug treatment specifically for MND symptom. It is used only to slow the progression of MND disease. We need to keep in mind that MND is a rare condition and the accurate causes are unclear. However, some studies suggest that certain lifestyle changes may help reduce the risk of developing MND. Therefore, there are a few lifestyle we can do. The first one is avoid exposure to toxin and chemicals such as much as possible, especially for someone that works at a workplace with chemicals, because the more we get exposure to chemicals, the more disease we can get. The next one is maintain a healthy body mass index or BMI. Having a healthy BMI can significantly reduce the risk of developing various health conditions. Research has shown that individuals with a higher BMI are more prone to chronic disease. By maintaining a healthy BMI, you can lower the risk of developing this chronic disease and improve overall health. After that, we need to take a certain nutrients to diet, such as vitamin E and antioxidant to boosting our immune system. Then, we need to check our cholesterol to make sure it is not higher than usual. If our cholesterol is high, that means the excess build-ups on the inside of our artery as plaques, filling up the walls and reducing blood flow. The last one is take a quick burst of physical activity each day can burn more calories, increase metabolic rate, and improve endurance and strength.
MND attacks cells in the nerves called motor neurons. These cells control movement. Motor neuron disease weakens the muscles until they no longer function. A person with MND will usually die between 2 to 3 years after diagnosis, but this can vary from person to person. Some people live many years after their diagnosis. This is what happened to the greatest striker Malaysia, which is Mokhtar Dahari. Mokhtar began having throat problems and went to the hospital to find out what the problem was. Doctors diagnosed him as having MND. The press reported Mokhtar suffering from muscular dystrophy as the cause of his death. Mokhtar Dahari has started off his career as a football player when he was only 19 years old. Research has reported the excessive training and frequent strenuous exercise can increase the risk of MND. After 3 years battling the disease and his condition worsening, Mokhtar Dahari died on 11 July 1991. In conclusion, there currently isn't a cure for MND, though researchers are actively looking for one. But there are treatments to help reduce the impact it has on a person's daily life, such as physical and occupational therapies, corticosteroids, surgery, and many more. But keep in mind that all of these treatments may not be appropriate or wanted by some people living with MND. MND affects everyone differently. Therefore, maintain a healthy lifestyle is crucial to prevent getting any critical illness. You can do a monthly checkup if you have some of the symptoms of MND.